Now, the freezing of posts in the healthcare sector will place the delivery of services under worse strain. This is a concern raised by the sector at the Public Health Association of South Africa Summit held in Gqeberha. It comes after National Treasury's instruction not to fill a number of vacant posts. For more on this, we're joined by Russell Rensburg, who is the Director of Rural Health Advocacy Project. Russell, good afternoon, and thank you so much for joining us.
Welcome, Gqeberha, and thank you again for the opportunity for us to share.
Let's get straight to it, and on that, I mean, your reaction to this possibility of freezing of posts. What's your initial reaction to that?
It's like, it's cutting into the bone really. We haven't really had any significant expansion of the health workforce since 2012, right? And we've had a series of of sort of different kinds of freezing since 2015. So our capacity as a health sector is very, very challenged at the moment. And while we understand that there are some financial and fiscal issues at the moment, you can't have a health sector without healthcare workers. So we need to have more engagement with the Treasury, the provincial departments of health, who are the principal employers of healthcare workers, of how we ensure that there's a continuity and expansion in healthcare services rather than a reduction.
Would you then say, from what the minister has said and what are the guidelines that have been issued, because primarily it, at least from their perspective, looks like it's a question of not having enough money to continue with this post. Would you yeah?
This is really difficult. At this stage, we don't really have the exact details, right? We know, for instance, that the wage agreement that was agreed on earlier this year was applied retroactively. It wasn't budgeted for in the February budget. So the result is that many of the provinces are already overspending on HR compared to what they budgeted for at the beginning of the year. In some instances, it's leading to a shortfall of around close to 9 billion rand across all 9 provinces. Right? And if you think about the reasons that they give for the shrinking fiscal space, the likelihood is that these could be the in a series of cuts, not just a singular cut. And in order to run an effective health service, I think we have to invite more people to the conversation on how we ensure which posts are prioritized, where they are prioritized, and ensure that whatever available capacity is in the health system is sufficient to meet the needs of the majority of the population. So I think there's hard conversations, but they shouldn't be done unilaterally. There should be more transparency around how decisions are made, and I think there should be greater engagement around which of the posts that are critical. Because all healthcare posts are critical, be it the cleaner, be it the porter, the doctor, the surgeon. And without any of those, and even administrative capacity, if we don't have sufficient capacity to run the system, we just end up creating a much bigger problem than the one we're trying to solve.
Would you then say, Russell, that looking at some of these posts will be a question of generally prioritizing which posts to fill, or generally, as you say, looking at the picture and trying to find the accurate solutions to make sure that there is a balance, if I can put it that way?
No, absolutely. I think when we developed the National Human Resources for Health strategy, which I was involved with, I think one of the things that we spoke about was really developing a more evidence-based matrix to determine where we need posts. Right? So at the moment, all posts are funded through what they call the provincial equitable share, which are given to provinces almost unconditionally, and they determine more or less how that money is spent. So what's been happening over the last 10 years is that we're essentially just maintaining what is there, and we're not adjusting for greater population health needs or where there's a greater need. In rural areas in particular, because they're far from the centers and there are no large hospital complexes in the rural areas, and healthcare is almost completely reliant on the state sector. When vacancies arise, they're often not filled because they're far from the maddening crowd. So without a clear, transparent framework that looks at posts across the country or across the province and then determines priority based on need, rather than maintaining an inefficient system that we have at the moment, will result in more inequity. And I think this can't happen just through a straight top-down instruction from Treasury. There has to be engagement with the broader health sector as a whole.
And I mean, from that point, it is well documented, Russell, that there are indeed a lot of vacancies out there that are available, isn't it?
Absolutely. I think in the last count, I was just checking the numbers. There was a parliamentary question earlier in the year, and there was a total of close to 1,000 vacant posts, right? And that's using a 2007 post structure. It could be much bigger than that. And the vacancies exist all categories of employment, from 15% amongst nurses to 8.4% amongst medical practitioners, and specialist nurses is a big problem, and specialists. So when you look at the parcel of money, we have to really consider where's the capacity best used, how are decisions made around what posts to cut, and who's involved in those decisions. And I think all that we're asking for as the Rural Health Advocacy Project is that these processes are transparent and multi-sectoral, so that when they do arrive at the final post makeup, what we have in the public sector services the needs of all the people reliant on publicly funded healthcare.
All right, Russell, we're going to have to leave it there, but thank you so much for joining us. Russell Rensburg, who is the Director of Rural Health Advocacy Group, talking to us there about the freezing of posts and, of course, saying that this will be detrimental.